Vulnerability is a widely used concept in social policy, especially in the UK, with policing now playing a key role in its application and implementation. But we still are unclear about what it actually means in practice. And this leads to inconsistent outcomes across policing and partner agencies. So there is a need for a better understanding of what the concept does in public service provision, for a more standardized approach. And therefore, in Vulnerability and Policing Futures Research Centre, based in social policy here at York, we undertook a study to identify and explore different opinions about how vulnerability shapes public service provision held by police, partner agencies, and people who are considered to be vulnerable. So this was our research question. And we used an innovative technique called Q methodology. Our sample included 18 police officers, 18 service providers from housing, education, health, and different NGOs, and 25 service users who access those public services because of multiple vulnerabilities. So we asked them to rank 44 subjective opinion statements across this grid according to how much they agreed or disagreed, and then we follow up some questions to understand their reasoning in a bit more detail. So this Q methodology enabled us to talk about diverse viewpoints rather than talk about groups, like the police thought this and service providers thought that. We were able to talk about different viewpoints held by a diverse members of participants. So when we did the factor analysis, we found 3 different viewpoints. These are still working titles. So the first one was vulnerability positive, the second one was critical of services, and the third one was more realistic about the policing role in relation to responding to vulnerability. So factor 1, this group was the most diverse among all, but predominantly made up by service providers, with also service users and police staff. As you might see from the 2 statements at the extreme ends, the viewpoint was defined by an optimism about policing being more involved in responding to vulnerability and supporting vulnerable people alongside more traditional functions like crime fighting. And there was an emphasis on the importance of understanding individuals' backgrounds and working closely with other services. The second viewpoint, this group was dominated by service users with no police members, and this viewpoint was defined by a distrust and skepticism towards the police and public services, supporting people who are considered vulnerable, and the criticism was mainly about institutional failures such as racism or the harming potential of information sharing across services. And the third group, this was police heavy, as you might not be surprised. So, and it was defined by an ambivalence about whether the police are the best agency to support vulnerable people because of shrinking resources. Differing from the other 2, this group believed that the police are vulnerable due to multiple reasons, and they advocated for a more restricted role for the police. This was mainly to be preventative of vulnerabilities through fighting with crime and signposting those vulnerable victims to other much better trained agencies. Despite disagreements, so each of these 3 groups had consensus on mainly 2 points. One was strong disagreement with the statement that calling someone vulnerable is offensive. And the second one was that they moderately or strongly agreed that vulnerable people don't often see themselves as vulnerable. So all these have given us a lot to think about and reflect on, and we have just started data analysis and interpretation. And our next step will be to consider how we can use these diverse viewpoints to help improve public service provision targeted at those considered vulnerable. So there's more going on in our center. We are focusing on different types of vulnerabilities and how it is policed in the UK. And we are on Twitter and LinkedIn, so do watch out those spaces if you're interested. Thank you.
Thank you for all the speakers in session 2. We will now take a very short 5-minute break and get ready for the third session.